Have you spent a lot of your time trying to control your type 2 diabetes or your insulin resistance by just working harder and harder, and you're struggling with your weight and feeling like a failure? You are not alone. This is a common scenario, and a lot of times, like most objectives, there needs to be rethinking of strategy or questioning of the existing strategy to break through and finally get the results that you're looking for. This is Dr. Adam Reddy. Welcome to this episode of the One Thing podcast, and I bring on Sami Inkinen, the CEO of Virta Health, to talk about type 2 diabetes and obesity in this country. He does a lot of work bringing type 2 diabetes strategies and approaches to the masses as the CEO of Virta Health. Sami explains why we've been going about this all wrong with approaches to type 2 diabetes. He'll share some science behind his approach with Virta Health, approaches to nutrition that's helping to reverse type 2 diabetes, helping people lose weight, and helping people get off insulin. I think this will be a good episode to navigate all the information that's out there and give a view of a potential strategy to help with insulin resistance and type 2 diabetes. So without further ado, I welcome you to the next episode of the One Thing podcast. And please let us know how we're doing with our podcast. And if you enjoy this episode, please subscribe to all our channels. Thank you so much. Sami, welcome to the One Thing podcast. It's so great to be here with you today.
Adam, thanks so much for having me.
You're welcome. Yeah, it was great getting to know you a little bit offline here. The fact that we've lived in 3 of the same places is fairly interesting. You're living in Colorado now, and we both also lived in Seattle area and the Bay Area. How have you found living in those different regions? Which one's your favorite so far?
Very good question. What I would say, every place is special. First, I should say I grew up in Finland and I came to America 2003. So I'm used to 4 seasons and lots of lakes and lots of waters. Every place is special in its own way. And you live in Seattle. So why don't I say Seattle? Because
Okay.
I love the summers. I love the fact that once the rains went away, the summer felt so extra special and lush. And you could see the snow-capped Mount Rainier from downtown Seattle. So yeah, I say Seattle for now.
Great. And so you've been working with Virta as a CEO, but you came into Virta from the world of real estate. Is that correct?
Yeah, I would say technology. And if you don't mind, I'll just very briefly share. So obviously one of the co-founders of Virta Health, but in terms of background, because as I explain my background, it may sound like, wait, what are you doing in healthcare? So I grew up in Finland, as I mentioned, as a physicist, which was my formal training. And I started my career in a nuclear power plant, which obviously has very little to do with healthcare. So that was my first real job. But technology and software was always something I was interested in. I got into computers very early age. So I would say software was the trade or the tool in my back pocket. And then when I came to America 2003 and moved to San Francisco Bay Area, or Silicon Valley, as we techies like to say, I should say.
Yeah.
Indeed, I started a company called Trulia, which at the same time around your neighborhood in Seattle, Zillow got started. So
Right.
Trulia and Zillow were basically doing the same thing, online real estate marketplaces. So I started Trulia, and the folks there in Seattle started Zillow. And but yeah, I co-founded Trulia and built it over 10 years. And then now it's obviously part of Zillow. So my background is in tech and science, and came to healthcare from completely outside. And we can go into the reasons how the heck did that happen. But yeah, that's my background.
Yeah, it's interesting because now we're connecting so much with bigger decisions people are making through online sources. So like even now in the work you're doing today is you're connecting with important decisions like real estate decisions and healthcare decisions through an online format. I'm just curious, like, how do you make something like that? This is a big question, but how have you been able to connect with the human side, making something personal like that when it's such an emotional, it's an emotional topic.
Yeah, maybe a little bit tongue in cheek. I start here by sharing a fact, which is that I've been married now almost 14 years, and I actually met my wife online as well on
Oh,
Match.com.
wow. Okay.
So I have a personal experience, not just helping people find their dream home to buy or sell or rent online, but I also met my wife online. So a little bit tongue in cheek. Let me maybe mention a couple of things. First of all, for listeners' benefit. So what we're doing at Virta Health, we are solving the health epidemic of our generation, at least I think of it, and that is type 2 diabetes and obesity. So we fundamentally reverse type 2 diabetes and obesity, and we do that through a nutrition program, but it's really delivered digitally, so virtually online. And we have medical doctors and coaches, but all that interaction between our team, our Virta team, and the patients is fully digital. And so to answer your question, first of all, I would say, I think if we go back to 1998, 1999, 2020, 24 years ago, yeah, those were the early days. Like most people, including myself, we were very uncomfortable even giving our credit card number
Yeah.
online. And it was like impossible to do e-commerce before Amazon because very few people would just give a credit card number on a random website. So at the time, I'm sure if we had thought, oh, you're going to tell the most secretive personal and health information online and trust the doctor, trust someone who's who basically has your life in your fingertips through a smartphone or computer, that's ridiculous. That's never
Yeah.
going to happen. So I would say one thing is just time. And now average age of our patients, Virta patients, is somewhere between 50 and 60. It used to be 56 years, might be a little bit lower now. But these are 20 somethings who are used to doing everything on their
Right.
smartphones. I would say one thing is just that I think people have gotten so used to doing banking and healthcare things online, and I'm sure COVID accelerated that. So that's one thing. Then the second thing I would say, we use software and AI and data and all the buzzwords and this and that, and try to build our apps and experiences as modern as Instagram or Facebook or whatnot. However, we have human beings. We have Virta Health has coaches, medical doctors. So we have human beings taking care of our patients all the time. And we are very clear when it's human and when it's software. And I think that's one of the superpowers that AI, artificial intelligence, may never or may take a very long time can overtake. And that's empathy, an
Right.
ability to connect with another human. So it is possible to have that sort of human to human relationship online and digitally. And I think that's a key part of being able to deliver the experience and the outcomes that we've delivered in reversing diabetes and delivering sustainable weight loss.
Yeah. Yeah. If you've ever had a disagreement with a chatbot, it really tells you the difference between a human and a robot. They've got a long ways to go there.
And I'll also give you an example. Now, more than 100,000 Americans have benefited from our diabetes reversal and obesity treatment. So this is a people. And then every Monday, our Monday all hands for the whole company, we start with a little 30-minute meeting. But every one of those meetings starts with what we call a member voice. So one of our Virta patients, Virta members, joins this meeting, which usually is virtual. And oftentimes we ask, just if you want to share, why do you think you've been able to either reverse your diabetes or lose a lot of weight when, let's be honest, we've all, almost all of the patients have tried 5, 10, 15 things over 10, 15, 20 years, and they failed with everything. And so we always ask this question, what do you think is so special? What have you observed? What's so special? And of course, we know there's the science and approach, and we know how we manipulate the biochemistry, and we know why scientifically the Virta treatment, our nutrition program works. But 99 out of 100, practically 100% of the time, we hear the one thing, which is, oh, it is the relationship with my Virta coach and the provider. So what people tell us is it is the relationship and the way that person supports me. Now, whether that's the thing that actually drives the outcomes, I'm not going to be arguing, but that's the perception and the feeling that people have, which is, it's remarkable, but we
I
hear
believe
that
it.
half the time.
Yeah. I personally have been trying to help people reverse type 2 diabetes for nearly 20 years. And yeah, I would say those types of when people know you care and know that you're fighting the battle with them, and it makes a big difference. It's a tough road to do it alone. And yeah, and along those lines, to back up and ask you, when people first find out they have type 2 diabetes, like how much do you feel that people have a sense that it's their fault? Or how much do they feel that they don't understand how this happened? Meaning, I think there's an impression that you get type 2 diabetes because you're lazy, or because you didn't eat right, or because you didn't exercise enough, or because you chose the wrong food. And people just assume that's the reason you got it. How much of that, in your impression, is the engineering pathway to this issue, or how much of that is falsely assumed?
First, I will say what I've experienced and observed now as a co-founder and CEO of Virta over almost a decade, and what I think is objectively and scientifically true, and then I'll share the
Yeah,
perception. What's objectively true is that type 2 diabetes and obesity is a metabolic disease.
right,
That's it. Nobody wakes up on a Monday morning and say, or whichever day, and say, "Hey, I'm gonna eat and gain 100 pounds and develop type 2 diabetes."
right,
Nobody. I have not met a single one of our members who hasn't tried to fight against their metabolic disease. Yet, time after time, they failed. So it is a
right.
metabolic disease. But I'd say the perception and reality in the human minds and on a societal level, unfortunately, is that we shame and blame people who have type 2 diabetes, obesity, and for the most part blame that it's their fault. And by the way, that's now about 60% of American adults. So more than 150 million American adults, the people who don't have it yet, are looking down. And I can share my personal story, which led me to get interested in this topic and then teaming up with a couple of scientists and start Virta. But throughout those years that I was building truly my previous company, I was high performing endurance athlete, did a lot of triathlons, and even ended up winning the world championships in triathlon in my age group 2011. So I was very fit. Did the Hawaii Ironman world championships 7 times. So I was very fit. And I certainly was thinking, if you have diabetes or obesity, you can only blame yourself. You
Right.
can only blame yourself, because I'm not that. I know what I can put into my mouth. Yeah, I need to fight and use willpower and whatnot. And all that changed when I then discovered that me, myself, I was actually pre-diabetic and on my way to type 2 diabetes myself. And I thought,
Hmm.
what the heck is going on here?
Hmm.
And then met with a couple of scientists, Stanford and MIT trained, and they explained to me and showed the research that, hey, if you eat the wrong things, you're hungry and cravings, and even if you stay lean by exercising and burning the calories, you can become metabolically unhealthy and become insulin resistant and pre-diabetic and type 2 diabetic. So I have to say, I had to, pun intended, eat the humble pie myself and say, hey, way too many people, including myself, was thinking, if you develop metabolic disease, it's your fault because it's your choice what you eat. But in reality, that is not true. But yeah, I think there's still way too much of that sort of finger pointing and shaming, that,
Yeah.
oh yeah, if you're obese, blame yourself. If you have type 2 diabetes, blame yourself. And honestly, I'd say all medical doctors are well meaning, but there's a lot of that among primary care doctors, like, oh my God, seriously, you've gained another 50 pounds. Seriously, your blood sugars are. And so I don't think the environment is helping anyone. We are making you feel bad about yourself and saying, try harder, just exercise more and eat a little less. And despite the fact that we have 3 decades, 4 decades of experience, that telling someone it's your fault, eat less and exercise more, is not working. It's fundamentally not working. And that just
Right.
makes matters worse.
Yeah, I'm really glad to hear you say that. And I think it's often a barrier for people to getting help if they just assume they're just going to hear the same message and get the same kind of like kick in the rear, and it's not working for them. They'll fail to reach out for help. And I think the online format also allows people to feel a little bit more comfortable reaching out connecting in a way that maybe feels less safe than walking into a clinic. The first thing they do is throw you on a scale, and you're already being judged the first in the first minute you're in the clinic.
Yeah.
I can see that. But that being said, people do know that they're developing this metabolic issue. They need to make some changes, and diet and lifestyle and is step number one. Is there, from the old days of the research for type 2 diabetes, was there a flex that Virta saw that needed to change, that was not working in the kind of basic guidelines, that you saw like an opportunity that might be more successful?
Yeah, they have, quite frankly, the entire foundation and reason for starting Virta was to fundamentally change the paradigm in type 2 diabetes care. For the last, let's just say, 3-4 decades, type 2 diabetes has been seen as a chronic progressive disease where the best we can do is to manage it by medications, managing a symptom of type 2 diabetes with medications. So you take blood sugar medications, whether that's SGLT2s or sulfonylureas or insulin to lower your blood sugar. But the entire paradigm was, it's a chronic progressive disease. Once you have it, the best we can do is to keep upping the dose of medications to keep your blood sugar lower and slow down the progression of the disease. So the entire premise of Virta was to say, that's ridiculous. That's BS. That's actually scientifically wrong. This is a nutritionally reversible disease. In fact, that's safer, that's cheaper, and that's better for human health. So we should start reversing this disease nutritionally. So that was the entire premise for Virta. And if we go back in history, and this may sound crazy, but 100 years ago, before insulin was discovered, type 2 diabetes, which was very rare at the time, was treated and reversed nutritionally.
Right.
In fact, type 1 diabetes, which obviously is irreversible, but that also was treated nutritionally very effectively. And then things changed in sort of 1920s and afterwards when insulin was discovered. And things changed that we started telling people just keep eating the same bad stuff, particularly sugar and carbohydrates. Just take more medications to cover up the blood sugar spikes. And then we had sort of a 100-year run-up of more type 2 diabetes, worse outcomes, more costs, more complications. And so if you really want to simplify it, what we are trying to do at Virta Health is to go back to what we knew 100 years ago, and somehow we forgot it. And now we're just saying, this that is type 2 diabetes. This is a reversible condition. It's reversible nutritionally. It doesn't take heroic efforts. This is not a willpower exercise. If you do the right things, you can get rid of this disease. You can get rid of insulin, and we can go into our sort of clinical outcomes. But yeah, for most people who reverse their type 2 diabetes, get rid of insulin, and maybe they've had it for 10, 15, 20 years, frankly, they're angry. They're angry because they go, seriously? Why did I suffer with this for 20 years? And now you guys and girls have reversed this in 6 months. Why didn't I know this 15 years ago? I'd be so better off, and I'd probably have saved tens of thousands of dollars.
Yeah. Yeah. And I think even with those, in those days, they were predicting, even in those days, that medications could only do so much. So the goal and the target of therapy wasn't to get the A1C down to within range. It was just, we'll do our best.
Yeah. Yeah, absolutely.
And we'll do our best to get it as low as possible. But the expectations wasn't that the meds were going to get the A1C below 7%.
Yeah. And
So
I was going to add, it's almost embarrassing how badly in the United States and in all developed nations we've addressed type 2 diabetes. We're spending the total cost is somewhere between 300 and 400 billion a year in America alone addressing diabetes. And what we have to show for that annual spending over the last 3 decades is we have more people with type 2 diabetes, higher percentage of people have type 2 diabetes. The total cost of treating diabetes has gone up. The cost per person treating type 2 diabetes has gone up. And on top of that, you might say, but the outcomes may have improved. Actually not. There was a large-scale study published in JAMA, which is a very respected peer-reviewed publication, 2019. And the conclusion was, over the last decade in the United States, the type 2 diabetes outcomes have not improved.
Hmm.
Like,
Okay.
it's ridiculous, which is basically, this is just a long way of saying the current approach of treating type 2 diabetes as a progressive disease, only treating the symptoms, that is high blood sugar, with medications, is fundamentally not working. It's complete waste. And so
Yeah.
we have to take a better approach, which again is to reverse it nutritionally.
Okay. So let's talk about the nutrition a little bit. Just from a philosophical standpoint, there can be some arguments about there's different roads to get to good glucose control. And is it fair to say that it it that there can be different ways to get the same results? However, individually it's different based on the person, meaning people are going to respond different to different dietary strategies and people are going to comply to different strategies differently.
Yeah, first up front, I want to say, while I have 2 master's degrees, I'm not a medical doctor, and I don't play one on the internet. So I will
Yeah.
be very careful what I say and try to be very evidence-based, and what I
Yeah.
will say next will back up with data. First, I would say, whatever works for someone, go for it. It's good for you, nutritionally or otherwise, in addressing type 2 diabetes. But in terms of data that we've published and peer-reviewed from Virta, I would say 2 things. One, individualized carbohydrate restriction, so lowering carbohydrate intake, has been incredibly effective and certainly a tool that works. And I will say this, we have been able to show that it works with everyone who has type 2 diabetes,
Hmm.
which is caused by insulin resistance. And I'll just give you example data points. 94% of our patients at 1 year who come on insulin have it either completely eliminated or reduced. And in terms of dose, on average on a population level, it's down about 60% from start to year 1 and 80% at year 2. And simultaneously, blood sugar as measured by A1C is down by 1.3 points. So this idea that you get people off of medications and simultaneously your blood sugars comes down is unheard of in type 2 diabetes care.
Yeah.
And many other, we call it diabetes reversal, when somebody's completely off of diabetes specific medications and blood sugar A1C is below the diabetes limit of 6.5%. A1C, so 60% of our patients reach that at 1 year in our prospective clinical trial. So that's one point I would say, that in light of our evidence, individualized carbohydrate restriction works incredibly well in improving and reversing type 2 diabetes. The second thing I would say is, there is this debate by scientists and clinicians that is it about, say, the carbohydrate intake, or is it weight loss? And what I will say is that there's a very heavy degree of correlation. So patients lose weight and they achieve glycemic control. And typically it's the more weight they lose, the faster, the better glycemic control. So there is a very high degree of correlation. However, what we've also been able to show is that blood sugar comes down way faster than substantial weight loss. Also, insulin resistance, as measured in HOMA-IR, and fasting insulin levels come down much faster than substantial weight loss. While this is not a conclusive answer, this question of, is it all about the weight loss? If you can lose weight, however, you just reduce calories and eat whatever. Is that the solution? In light of our data, we've shown that carbohydrate restriction works first and weight loss follows second. So that's at least what our data shows. But again, if people can achieve better diabetes outcomes and diabetes reversal through other nutritional approaches, obviously high five, and you should definitely go for it. So yeah, post that.
So this is falling in line with the insulin, like insulin control theory of reversing insulin resistance through lowering insulin. Is that like lowering an insulin response, lowering insulin in the body in response to food?
Yeah, so if you eat foods that don't produce blood sugar spikes, then obviously the body has much less need for insulin, whether that's exogenous or endogenous. So we lead with nutrition And then obviously the body needs to produce less insulin. And then if you're taking exogenous insulin, meaning medications insulin, we are in a position to rapidly reduce the insulin intake. So absolutely right. And then if you flip that around in a current type 2 diabetes care paradigm, it's also blowing that if someone has type 2 diabetes, they're insulin resistant, we tell them to eat more carbohydrates with spiked blood sugar, and
Yeah.
hence you need more insulin. So you might say, wait a second, if someone has diabetes and they're insulin resistant,
Yeah.
how does more insulin solve that? I would say it doesn't.
Yeah. Especially the guidelines don't indicate anything about quality of carbohydrates or anything. It's like you can have 55% of your diet from carbohydrates or what have you. Doesn't matter as long as you stay to 55%. That's the standard diabetes guidelines versus quality might make a difference. So along those lines, do you, with the food and nutrition guidelines, what's your take on quality of food and how that impacts outcome? For example, phytonutrient, antioxidant content, those types of things, omega-3 intake.
Yeah. This is, first of all, I think you earlier mentioned this about individualization. So I have to say that our goal is to help as many people as possible reverse type 2 diabetes and obesity. And consequently, one size fits all, like this, it's this or nothing, this absolutely doesn't work. And just to give you obvious examples, so we work with large employers and health plans and government entities like VA who pay for the treatment. So you can imagine, and Native American tribes. And so we have a whole host of different types of folks. So just to give you an example, we work with US Foods, which is a lot of truck drivers hauling food around the country. And most of these folks, while they're driving, they only have access to food on truck stops. And many of them love like burgers and this and that. If you tell someone who eats meat and burgers 7 days a week, you need to become a vegetarian and only eat steamed spinach, they're going to run to the hills and say, goodbye, this is not for me. And vice
Right.
versa. If there's a vegan person and you tell bacon and eggs for breakfast every day, they're going to be like, okay, this is not for me. So that's not what Virta. So we individual, you can be a vegan vegetarian, we can reverse your diabetes. You can love burgers, we can reverse your diabetes.
Nice.
We work with Native American tribes, and oftentimes these folks, they work in casinos. They only have access to casino food. So we have to be able to individualize around what food they have access in casinos. Then we have stay-home dads or stay-home moms who might shop at Whole Foods. They cook at home for themselves and their family. Now, obviously, we can give a whole different level of recommendation for them. So
I
to
love
answer
it.
your question, number one, super high degree of individualization is absolutely needed to be able to help quote unquote populations or masses.
Yep.
So one. Second thing is, certainly we have a hierarchy of priorities. And so now it would be amazing if everyone could eat organic vegetables, grass-fed beef if they eat beef and red meat. But not everyone has access to those. Not
Right.
everyone is also economically in a situation where they can shop organic vegetables and grass-fed beef and this and that. So we always approach in sort of order of priorities. For example, if we need to reduce your carbohydrate load, you literally eating at a burger joint, we say, all right, let's switch the Coca-Cola to Diet Coke. Is that optimal? Not, but if that's what you want, let's do the Diet Coke so there's no sugar. Let's still order the burger, but let's replace the buns with lettuce. And by the way, ketchup is pure sugar, so let's try to not have ketchup, maybe just mustard instead. So that's an example of customizing within the context. And then there's another person who says, yeah, I shop at whatever, Whole Foods every day. It's like, fantastic. Let's keep buying the organic vegetables and we'll
I love
kind of.
it.
So that's the way we think of the pyramid or hierarchy, that we just can't go to the tip of the pyramid, the perfection, and that's fine. We can
Yeah.
reverse your diabetes literally on a fast food restaurant diet. Now, that is not the healthiest, but it's still better to reverse your diabetes than have the diabetes thriving and with all the complications that come from it. So that's our
Yeah.
approach that we take.
I 100% agree with that approach. I think the world to accomplish something as difficult as reversing type 2 diabetes. Flexibility is a necessity. Otherwise, as we were talking about earlier, the frustration
Yeah.
and just feel like giving up. It's like it's too high of a goal or it's not sustainable. And reminds me of early in my training for nutrition, we would, and this was before like HIPAA was a big deal or whatever, we would meet our patients at the grocery store and
Mhm.
shop with them. Don't walk around with them and see what they pick up and talk with them about what they're eating and what they're choosing and talk about alternatives. And it was just a great way to meet people where they're at.
Yeah.
And we have to do that virtually now, but it really helps to meet people culturally and financially where they're at, like you're doing. That's really great to hear and gives me a visual of what people would experience. So with that being said, are the changes, and I have a feeling you're going to give me a similar answer, but I just hear like the change model. What kind of change model do you have philosophically? Because there's all kinds of stages of change,
Mhm.
and some people relapse. And let's be honest, like sugar's addictive and it's basically a drug. And if you've been eating lots of high processed sugar foods for a while, it's something that's really hard to reduce or give up. And so people might go through a phase of withdrawals or changes. Tell me about your change model.
Yeah, maybe a couple of things. And of course, the ultimate is it depends and it's individualized and yada, yada, yada. But obviously, that's not very entertaining or useful for you. Number one thing is to get people, initially to get people in, is explaining the facts, which is it's not your fault. Yes, you're metabolically unhealthy, likely if you're applying to become a Virta member. Yes, you've tried 15 diets. Maybe they've all failed or you've yo-yoed or gone back and forth. It is not your fault, 100%. Don't think you're different. That's the story of every single Virta patient coming in. So that's like a number one thing. We are very clear. This is not a willpower exercise. We are not blaming you because it is not your fault. You are not the person who has failed themselves and will continue to fail. So we make that very clear. That is the number one thing initially. Otherwise, people are afraid to join because they're like, I failed 15 times. Do I want to fail the 16th time? No, you won't fail. Very likely you won't fail because this is different. So that's the number one thing. Number two is then we basically teach you to understand why it is that you are how you are. We explain the carbohydrate intolerance, how, like you mentioned, sugar, processed carbohydrates create hunger and cravings. We explain I'm lactose intolerant, grew up in Scandinavia, so I can't have lactose. It's very easy to understand. I drink milk, my stomach hurts, right? But most people don't understand that what carbohydrates do to their body. So we explain, like, when you eat this, you're hungry 45 minutes later, and you're packing fat, you're gaining weight, yet you're still hungry. You're carbohydrate intolerant. We explain it. And we explain that if you reduce that, you start reversing the process. So that's the second step that we explain to you. And by the way, that works incredibly powerful. If you're a coach to a runner, just telling them run 5 miles every day, yeah, it's marginally helpful. But to explain, if you run 5 miles every day, this is what happens to your body. The reason you have to work out, take a day off, is because your body super compensates. When the athletes understands why and how, they're much more body. So that's the second thing we do. And then the third one is obviously the changes. And obviously we try to meet our patients where they are. We set the date when they start changing nutrition. We discuss whether they can affect their nutrition themselves. So if someone else is cooking at home and so forth. But we define and decide when they start. That's the third step. And then fourthly, once we actually start the nutrition change, to the extent possible, we actually change things very quickly at once so that we can change your biology as quickly as possible. Now, that's not always possible, and it's fine, and we can work
Mm-hmm.
around that. But what we try to avoid is, just to use an analogy, like you said, sugar is addictive. Let's just take tobacco as an example. Some people may be able to stop smoking by reducing from 20 cigarettes a day to 18 to 16, but freaking you addicted to tobacco all the time versus saying it's going to be hard, but we're going to stop on Monday morning, 8 a.m. and you're going to suffer for 3 days. but then you get rid of the nicotine and you're out. So to the extent it's possible for the person, we usually fix your nutrition like that so that your hunger and cravings disappear in hours or days rather than slowly but surely suffering for a month. That's a little bit of, and then again, high degree of individualization. There's a human support by a medical doctor, by a coach that kind of support that. But those are the initial 3 or 4 steps that we take.
That's so great. Yeah. Yeah. I think the person with type 2 diabetes, that's often a it's a journey that doesn't have a lot of sympathy from the public. And versus if someone's going through cancer therapy or they broke their leg or there's some like obvious illness or disability going on, not that we need that, but a little bit of compassion and sympathy does really help, and humanness, and that can really help you feel like connected to others and helps you get through tough times. But like the type 2 diabetes patients, people have no idea what they're suffering with or what they're scared about.
Yeah.
Can you comment about their kind of, it's like a private battle?
Yeah, absolutely. And if I just repeat the kind of the perception that we have in a society still too much, which is completely wrong, absolutely wrong, is the following. Oh, you got cancer. Oh, you got so unlucky. You are a wonderful human, but you got so unlucky. So unfair, unlucky. You just got dealt the bad hand. But if you are suffering from type 2 diabetes, obesity, it's like, oh my God, you loser. You
Right.
can take care of yourself. That is still the narrative in most people's minds. That is not true. That is wrong. That's scientifically, objectively wrong. And by the way, there's more than 100 million Americans now with prediabetes or type 2 diabetes. You had obesity, it's more than 150 million. So it's not 50 million Americans just suddenly got lazy and stupid. That is not true. But as a result of that narrative, people have a lot of shame. They don't want to talk about. They don't want to be shouting from the rooftop, I have type 2 diabetes. They don't like to tell that to their colleagues. There's a ton of shame, which in no way is helpful in healing or even reaching out for help. So there's a lot of that. And this is why, like, when somebody comes to Virta and applies first, we always upfront, we are like, you have metabolic disease. Here's why. Here's what's happening in your body. It's not your fault. And by the way, there's 150 million plus other Americans and billions globally who are suffering from the same thing. And just to put the punchline, if anyone's listening, isn't it like ultimately it's your fault? No, it's not. The default food environment that we have and the default food science and knowledge that we have is absolutely completely wrong. We've been told the wrong thing for decades. Like, just to be very specific,
Yeah.
you go to a standard average hotel or even look at some of the nutrition guidelines, frankly, from the government. This is what we tell people to eat every day, every morning. Cereals with skim milk, with jam, with the bagel and orange juice. Let me tell you what that is. That's called developing diabetes.
Yeah.
We're telling people to eat basically pure sugar or food items that turn into sugar in a matter of seconds or minutes. So literally,
Exactly.
orange juice, white bagel, cornflakes with some sugar and jam, that is literally the worst thing you can do to your body. Yet, that is what you get in even a nice hotel for breakfast. That's what some government officials still recommend as a healthy, low-fat diet or breakfast. That is completely wrong. And we poisoned a couple of generations of people. And I'll tell you one more example. So I have 2 little daughters. A few years ago when my wife was in the hospital delivering, I was just looking at the fridge. I'm like, what's here in the fridge? There was a gestational diabetes meal wrapped around the label, gestational diabetes meal. I was like, well, just out of curiosity, I want to see what it is. So what was it? White rice, sugary jello, orange juice, and a tiny chicken breast with no skin. And I look at it, I'm like, this is not pure poison, but this is pretty close. This makes diabetes thriving. So anyways,
Yeah.
I get overly passionate about this, but anyone who's blaming themselves for obesity and type 2 diabetes, don't blame yourself. Our
Yeah.
default food environment, and what we've been telling to people for 3-4 decades, is just outright wrong. Eating that kind of crap makes you sick and hungry and craving, and you're in a loop that's impossible to get out of unless you get some help and say, hey, by the way, actually, you should be eating this way.
Yeah. Yeah, exactly. I'll throw one in here as well, as if you ever stop by a food bank or the most affordable stuff or the white breads, and the stuff that's most available is the chips, the crackers, the cookies, the baked goods, the cinnamon rolls. There's no eggs, there's very few protein sources. It's all floury processed carbs that's free and available to people who can't afford to eat. And so that's what we're providing to people. And yeah, I hear you. I really, it's such a healthy attitude, because so many programs I've seen, and I want to get into one other topic before we wrap up, but so many programs I've seen over the years want to make people be a certain way, be like me, and everything will work out. And I think it's there's a sexiness to it and everything like that, but it ends up being so frustrating for people. And to see what you're doing is a flexible model that is based on science, but still you're using more of a public health view, is really refreshing. So thank you for doing that. Before we wrap up, I want to get into one really important topic, and that's the GLP-1 agonists, because I think these have really come on the scene. And for a lot of people, and doctors included, are really excited about the outcomes and the possibilities of these medications in helping get better blood sugar control, weight loss, lower cholesterol, and lose weight. And so I just curious, how's that changed what you do? Have you seen this as complement? Have you seen it distort the message? Have you seen people fall back and not be considering nutrition as much as a foundation, since these have been getting so much press?
Yeah. First of all, on a high level, these GLP-1 drugs like Ozempic, which is probably the brand name most people know, has been a huge tailwind for Virta and our business, and helping people with type 2 diabetes and obesity, which may be intuitive. But to explain that just a little bit, first of all, yes, GLP-1's approved for addressing obesity is a new thing, about 2-year-old thing, and the first bigger brand name that was approved was Wegovy, which is the same drug as Ozempic, but approved for treating obesity. But the GLP-1s themselves are not new drugs. So the first one was approved for addressing type 2 diabetes, 2005. So we have almost 20 years of experience using GLP-1s for addressing type 2 diabetes. And just to make an obvious statement, has diabetes gone away? Is everyone with type 2 diabetes skinny and lean? No. So clearly this drug did not solve type 2 diabetes, did not solve obesity among people with type 2 diabetes. That said, as a obesity drug, they're certainly safer than the historic drugs. They certainly work better. So I would say, before I go into more details, as a tool in a toolkit, as a tool in a obesity and type 2 diabetes toolkit, this drug is a useful tool, as is bariatric surgery. But as is bariatric surgery, it wasn't the magic pill or magic knife that solved obesity. GLP-1s like Ozempic will not be the magic pill or magic injection that will solve obesity. And I'll give you a couple of reasons why. And it's not just the cost. First of all, these drugs absolutely, for most people, affect how much you eat, but it doesn't change what you eat.
Right.
And unless you address the what you eat, which is what we do at Virta, for example, you will not get fundamentally healthy, and you will regain your weight once you come off of these drugs. And the available evidence from PBMs, pharmacy benefits managers, and health plans who've looked at what percentage of people want to stay on these drugs or can stay on these drugs is less than 27% who start on GLP-1 like Ozempic stay on it even at 1 year. And
Yeah.
the moment people come off, weight regains. And so, again, useful tool in a toolkit, but it only changes how much you eat, not so much what you eat. And so you fundamentally have to address the nutrition in order to deliver sustained results, in order to have an off-ramp off of these drugs. And by the way, we just published a peer-reviewed paper that if you manipulate the nutrition again appropriately, you can get people off of Ozempic and maintain that weight loss. But that would be, so like most things in nature and medicine, the truth is somewhere in the middle. So useful tool. There's reasons to be excited about these GLP-1 drugs, but this idea that you just keep taking it forever and you stay happy, lean, and healthy is not true. You have to address nutrition as well, or otherwise you don't have sustained results.
Mm-hmm. Yeah, and I think that's a great message when anybody's launching into taking Ozempic or Mounjaro or something similar, is that it's a way to bridge. Here's where you're starting. Where do you want to end up with your diet and lifestyle? Even things like sleep, resistance training, nutrition, alcohol intake, all these other things that you can adjust and levers that you can pull or push to get to this goal of reduced metabolic inflammation. I think if you have that end game in mind, then when you come off it, it's been a bridge.
Yeah, absolutely.
So this has been really helpful. I'd love to wrap up with some just take-home points, and then anything you'd like to share about Virta, about how people can connect with you, and sort of anything that you guys are doing right now that you'd like people to know.
Yeah, absolutely. That's a broad question. Well, take home, maybe there's one or two things to say. I will say, and again, I try to only say things that data backs up and I can stand behind. I would say, number one, if you are suffering from type 2 diabetes or obesity, no matter what you may have heard or read, it is not your fault, yet these are also reversible conditions with nutrition, and it is not a willpower exercise. That's number one point. Metabolic disease is reversible with nutrition, and it's not your fault, and there's a way to do that safely and sustainably. And then a second point, just on Virta note, our goal is to make type 2 diabetes reversal and obesity reversal treatment completely free for anyone in America living with it. And the way we are accomplishing that is we work with employers and health plans and government institutions like the Veterans Administration who pay, and is literally free for individuals. So if you are interested in what you heard and learn more about Virta, Google Virta Health or go to Virta Health website, and most likely or hopefully you can get free access because your employer health plan is paying. And so you can check out Virta if that's interesting. So yeah, maybe those 2 points.
Excellent. Thank you so much. We really appreciate this. Was a really enjoyable conversation and very inspiring.
Yeah, thanks so much, Adam.
Thank you so much for tuning in to this week's episode of the One Thing Podcast. Please share these episodes with your friends, loved ones, colleagues, patients, healthcare providers, anyone who you feel might benefit from hearing these informative interviews. We tend to learn best from people sharing things with us. That's often the first time it's introduced. So don't hesitate if the content of these episodes reminded you of someone that might benefit from it. Forward the episode to them, and I'm sure they'll either appreciate it or be appreciative that you've thought of them. So once again, we'll look forward to seeing you next episode on the One Thing Podcast. And again, much appreciation for you being here with me.